The other day, I had the opportunity to speak with some of our colleagues around the world about the Hunger Project's COVID response. In every country where we work, Hunger Project staff and community leaders worked tirelessly to ensure that information about preventing the spread of the virus reached everyone. Rowlands Kaotcha, our global vice president, has more. Hi, Roland. Thanks so much for joining us today.
Thank you very much, Anna. My
So,
pleasure to be here.
could you tell us a little bit about how the Hunger Project and our program countries adapted during the lockdown period and how we leveraged technology to ensure that we could reach everyone?
Great. Thank you very much, Anna. First of all, let me step back a little bit and explain about what was our vision when the issue of COVID-19 came into the communities that we partner with on the ground. So standing in the social solidarity in the face of physical distancing, our vision for our program strategy on the ground was to have COVID-19 resilient communities everywhere we work. That means 14,000 villages where we work globally. And at the community level, that meant that reaching every last person with about 5 actions or 6 actions that were created and guided by our framework for action. Now, what are these 6 actions that really guided our work on the ground? First, it was awareness and understanding on how to stay safe, promoting issues of hand washing, physical distancing, face covering in public places like putting on of masks, as well as debunking misinformation, which was very crucial in most parts of the communities we work with, especially in Africa. And then promoting acceptance of vaccines. The third one was to have access to the washing stations in every community that we work with. And the fourth was to be able to identify and isolate symptomatic residents and linking them to health officials where they could actually be supported for care. The fourth one was to ensure that there is access to relief for everyone who was in a dispute situation. And lastly, it was to promote community peace, trust, and solidarity. Now, I know that right now, as I'm talking like that, the question coming from you is, Rowlands, how was that possible? Considering the fact that even our own staff members, like it was with many other organizations, could not be able to travel to the communities in order to avoid rural to urban transmission. And that is where our uniqueness of the work of the Hunger Project comes from. You know, in Africa, we have the epicenter model. In India, we have the elected women representative model. In Bangladesh, we have the SDG union model. In Mexico, we have the SDG municipal model. These models, what they have done before 2020 was the training and establishment of about 500,000 people. 75% of them are women. These are community leaders on the ground who have a visible footprint in all those 14,000 villages that I spoke about, reaching about 16.5 million people on the ground. They are already trained in mindset change, behavior change, reaching everyone on the ground. They are already trained in not viewing things as victims, but as leaders. So not operating from the victim mindset, but from the leadership mindset. Now, while we saw that many NGOs on the ground, and I say that really respectively, on the ground were struggling to set up structures on the ground in order to respond to COVID-19, for us, with these 3 conditions, with these community leaders on the ground, we discovered that we were actually positioned, well positioned and placed, and we easily deployed that particular social capital on the ground to be able to respond and fulfill this vision of having a COVID-19 resilient community in every area we work with. Now, I know for some of the people, some of you, our dear investors who have been investing in the Hunger Project for many years, right now you're asking me, or you're asking yourself in your hearts and saying, Rowlands, but were we able to have any epicenter in Africa reach self-reliance during the period of COVID-19? I have good news for you, and definitely you need to hear this as I close. Sorry for that long explanation, Anna. You know, our program Resilience and Adaptability stood the test. The community leadership was not only visible in prevention, impact mitigation, or awareness and acceptability of COVID-19 vaccine, but guess what? Who could have imagined that within COVID-19 period, we had 7 epicenters in Africa reach self-reliance in the year 2020 and 2021, with a total population of about 105,000 people being able to stand on their 2 feet and declare themselves self-reliant. That's how the program, and that's how our Hunger Project was able to empower communities on the ground to respond powerfully to the pandemic. And we have now realized that the structure, social structure that we were supporting to build for the end of hunger and poverty is actually well positioned to respond to any type of pandemic, including a health crisis like the one that we are facing right now. Thank you.